Okay, everybody, I have Dee, the Medicare lady, here with me today, and she's going to help us with Medicare Part D because I know a lot of people get confused with this whole thing. It's the drug part of Medicare, and so I'm going to let her explain how Part D works.
Part D is sold by individual insurance companies nationwide to cover things like prescription drugs. Before 1985, there was no Part D. Families had to come up with the premiums in order to pay for their prescription drugs. Post 1985, people were able to purchase a Part D and they're region specific. So no matter where you live in the country, there are different Part Ds available, but that's what covers your prescription drugs. Now, Part D has a annual deductible of $505. If your drugs fall into a different tier, like tier 1 and tier 2, you would just have a copay. Whereas if your drugs fall into tiers 3, 4, and 5, you could see that drug deductible. I deal with drugs every single day. I deal with Medicare Part A, B, C, and D. So I'm able to pretty much field any questions that you may have.
Okay, so are all Part D plans the same?
No, they're all based on the formularies, and every insurance company has a different formulary. And you can always look that up on Medicare.gov, but of course that can be a little tricky. So that's where I come into play. I used to be a nurse, so I'm very well versed when it comes to the pronunciation and what tier your drug is going to be in. But I also kind of know what a prior authorization is, and I know the tricks of the trade with the pharmacies in order to get your drug covered. Sometimes Part D is not in your best interest, even though the federal government and the Centers for Medicare and Medicaid Services are going to penalize you for not having Part D. You've got to be careful because sometimes good RX or single care might be in your best interest financially.
Right. So if somebody is of Medicare age and they need to get a hold of you, how do they do that?
MedicareLadies.com. I'm located in Chicago. I'm licensed in a lot of states. I own the web address on Facebook, Instagram, and the Medicare Lady on TikTok. I think I own Medicare Ladies on YouTube too and LinkedIn. I've been doing this for 28 years. You can either follow me because I hope to do more lives, or you can contact me at my web address at MedicareLadies.com, and you can instant message me, or you could send me an email at any time, and my services are free to you and all your friends.
Okay, so I'm assuming that you look over what the patients are taking and then you can actually pick the best plan for them based on the drugs they're taking, their health issues,
I actually
and
use
save them money, right?
Right, exactly. It's all about what is in the best financial interest of the patient because your Part D is so very individualistic. So, what I do is I put your prescriptions into a very similar tool that we've been granted to use. It's very similar to Medicare.gov, but it also indicates what state you're in and what pharmacy you like to use. For example, I'm just going to say in the state of Illinois, United Healthcare is very much attuned to working with Walgreens. Okay.
Okay.
And CVS is an Aetna driven product.
Okay.
So it's no secret, but it depends on where you like to fill your prescriptions. Not everybody likes to go to Walmart. I have some people that love Costco. So we have to take that information into consideration. How much are you going to travel? Are you going to spend half your time in Oregon or half your time in Naples, Florida? Or are you going to be in Texas? Where are you going to be? Because if you need a nationwide pharmacy, that's also going to come into play. Everyone's formulary is different though.
So sometimes they can use mail order and sometimes they can't.
Yeah, if you can use mail order, it's kind of hard to change your address halfway through because if you start changing your address with a Part D and or a Medicare Advantage, which includes Part D, they're going to start asking questions like, are you going to be more than 6 months in one day in that different address? Because if you are, you're going to have a qualifying event to change your Part D to your new zip code. So you want to be very careful as to whether or not you're going to change your mail order if you're going to get mail order directly at your house every 3 months.
Okay.
That's a good way to save money
Right.
though.
Yeah. What tips would you give somebody who is either wanting to change their Medicare or going into it for the first time?
Going into it for the first time, please get yourself a really good advocate, somebody who's going to work in your best interest. Right now, we are outside of open enrollment period, which just ended on March 31st. So whatever you're in with regard to Medicare Advantage and Part D wise, you have got to wait until October 15th through December 7th for a January 1st, 2024 effective date, unless a qualifying event happens, like a move. If you move from one state to another, or you move from one service area to another, you will get a 63-day election period to make that change. Annual enrollment period is October 15th through December 7th. The annual open enrollment period just ended, which is formally known as the annual disenrollment period, which was January 1st through March 31st, which happens every year. So if you find yourself in Medicare Advantage and you don't quite like it, or it's not what the agent told you at the Medicare whatever hotline, I'm not going to name any names because we all have the phone
Right.
calls, all see the TV commercials, but if you have buyer's remorse with one of those plans, you can always go back to original Medicare between January 1st and March 31st and buy yourself a supplement if you qualify. If you don't qualify, then you can go back to original Medicare, buy another Medicare Advantage, or change your plan. But right now it's kind of too late for Medicare Advantage and Part D. You'll be able to do that during October 15th through December 7th. Now, if you're
What
aging
if you
in,
just turn what if you just turn 65?
if you're just turning 65, you have 3 months before, you have the month of, and 3 months after your birthday
Okay.
month to make a qualified decision. Now, if you're
Okay.
working for a large group health employer, meaning a group over 20 people, you can keep your employer's coverage, or you can stay on your husband's plan, your wife's plan, your domestic partner's plan. You can stay on the group health insurance plan until you're ready to retire. Most people who are turning 65 are not quite ready yet because the check, they're not fully vested until they're 66 and 3/4. Some people want to work till 67, some people 68. I hear 70 all the time. So that decision is very personal. But if you're aging in, my free educational seminars are wonderful and we go over all of your options. But your initial election period is a 7-month window.
Okay, so if people contact you,
Mhm.
it doesn't cost them anything different than if they called any other person, right? I mean, the 800 numbers or whoever they see on TV, it's the same.
Right. The
You
one
just
eight
give them more personalized service.
Yeah, the 1-800 numbers have somebody working in a cubicle 24 hours a day, 7 days a week. And then when they get your phone number, they never stop calling, unfortunately.
Oh,
I
okay.
am in a brick and mortar shop. I have been doing this for 28 years in the Chicago
Right.
metropolitan area. Mhm.
Okay.
Right. So
Got it.
there's always somebody to answer the phone at my office. We don't just, write a policy on you and then disappear after we get the commission. We actually care.
Right. Awesome. That's great.
Yeah, but if you go directly to United Healthcare, Aetna, Blue Cross Blue Shield, it's the same exact price as you would go through to me.
Right.
Right.
Right. They just get more personalized service this way. I think it's wonderful.
We're licensed in a lot of states and we're working at being licensed in all 50. That's quite a challenge. It really is. But, we're happy to help anyone because word of mouth is how we get around. I mean, I have people that call me from Florida and Texas every single day.
Right.
Say, we heard about you. Can you come and do a seminar in Naples? Can you come to Dallas? And I'm like, well, sure, but we have to have more than 2 people attend the seminar.
Right.
Yeah,
Right.
and the name of my seminar is I'm turning 65, now what?
Oh, okay. That's a good
Hmm.
one.
And we
Okay.
address Social Security and Medicare parts A, B, C, and D, and exactly what it covers and what it
Okay.
doesn't cover, because you have to be very informed, because a lot of people are under the impression that Medicare is what's going to cover them forever. And Medicare was never designed then to pay more than 100 inpatient days. And during COVID, that became quite an issue.
Right. And then there's gap insurance that you can buy and other
Sure.
types of products, right? So it
Dental
just, that's
vision,
why it's
hearing.
important that you get somebody that knows what they're doing so they can figure out what your situation
And
is, right?
right. Most people who are in Cobra are on the 64 and under marketplace. People that are on Obamacare are so relieved to go on Medicare. They're really
Yeah, no, I'm
relieved
sure they are. Yeah.
because it's expensive.
Right.
hmm
That's right. Yeah.
But you're on the pharmacy side of things.
Well, I mean, I'm a manager in a hospital. I mean, I do have a retail portion. You know, I deal with all the red tape stuff, I guess you would say.
So you deal with inpatient
Yep.
prescriptions,
Yeah.
which is
Yep.
covered, if it's 3 midnights or more, is covered under Part A.
Right. Right.
Part B is under 3 midnights. So it would be under an observation or things like that. That would be covered under Part B. But
Right.
still, it's necessary when you're in the hospital. Who's going to argue with the pharmacist, right? And or the doctor?
We got to keep them healthy.
Got to keep them healthy and make them better. Make sure that you are aware every time that you contact Social Security. The top 5 is Social Security forgot about me. Like, okay, that's number 1. Number 2 is they won't let me in. Okay, well, it's because of the COVID thing. Number 3 is they forgot about my husband. Number 4, they're telling me that I can get the check and I can work as much as I want. I'm like, you better double check with your financial advisor on that one. You have to be fully vested in order to
right.
make as much as you want on that check, but I don't get into the finances with that. Tips is caveat emptor, even though the television commercials, they're out there saying free, free, free. These plans are not free. You are subject to copays. Not everything with Medicare is free. And please understand your Social Security premiums, approximately $164.90 per month, is non-negotiable. You have to be on Medicare Part A and B before you can do anything. Part B is not free.
And your drugs may not be covered. What you're on right now, they might not pay for it.
Well, if you're coming off of a group health insurance program, you are correct. If you see it on TV, like some of these prescriptions that are self-injectable on TV, if you see it on TV, guaranteed it's a drug that's going to be in tiers 3, 4, and 5.
Yep.
And it might cause you financially to enter into the coverage gap, otherwise known as the donut hole. That's another discussion altogether. That could be a maximum out of pocket of $7,401 per year in plan year 2023. But some people are like, but I only pay $25 for my Skyrizi. Okay, let's just throw one out there. It doesn't matter. It's on TV. Okay. Yes. And I'm like, okay, but you're 64 and under, and you qualify for the program that they're talking about on TV. Like, if you can't afford your drugs, we have a program that can help you. That's for people that are not on a federally funded program. Once you're on Medicare, you don't qualify for the $25 coupon or $5 coupon anymore. Now, do I get hundreds of people that call up my office and say I'm going to use it anyway? Sure. I'm like, well, more power to you. Give it a try. The pharmacist usually catches up with them on 60 days and they're like, you can't use this anymore. You're on Medicare. And that's when your copays, after the 505 drug deductible, your copays can be anywhere between $500 and $1,000 a month for that drug until you reach and exit the coverage gap at $7,401. And people are like, you're kidding me. And I'm like, no. And then sometimes your drug is not even covered on the formulary. When we have that kind of discussion, Medicare might not be financially in your best interest. And that's a very private discussion in my conference room because it doesn't normally go very well. People are like, I was hoping to retire. I was hoping to go on Medicare and get in a Winnebago and drive across the country and just be free with my husband for the rest of my life. But I'm like, but your drugs are $25,000 a month. There's no way.
Right.
So, I mean, that can happen. And sometimes the formularies that these insurance companies have do not cover all of your drugs.
And sometimes you can switch to a different drug that is covered too.
That's a good conversation between you and your pharmacist, and a
Right.
really good conversation between you and your doctor.
That's
I
right.
never play doctor. I always refer people back to their doctor.
Because there's times where you need to be on a certain drug and there really isn't anything else that works. But usually there are things that you can use. So it just depends on what it is.
Yeah, and a lot of people go back to their doctor and they're like, "Did you know how much my drug was?" And the doctor's like,
Right.
"Yeah." "Well, I'm thinking about going on Medicare and I can't afford to stay on this drug." And the doctor's like, "Well, let's try this, that, thus, and so."
Yes,
So sometimes it works,
that's
and
right.
sometimes people have to stay on a certain drug for a certain condition, and it's non negotiable.
Tell all these people where they can get a hold of you again.
Okay. Insurance Benefit Services owns Medicare Ladies, Medicare, ladies, LADIES.com.
Okay.
And our phone number is 630-858-0121. And we're located in the Chicago western suburbs.
Okay. But they don't have to be in Chicago to call you.
Nope.
Just call and you'll let them know if you can help them or not. And if you can't, you'll find someone who can.
Oh, I will help everybody find anyone who can in their specific region of the country, but we are licensed in a lot.
Okay. Great. That's
Yeah.
awesome.
We're working on
Okay.
dates. It's going to take some time.
Right. Okay. Well, thanks for coming on.
Thank you.
And if you can think of another topic, maybe we should do a donut hole.
Donut hole can be deep. It can get deep in the conference room, but on the other hand, it can be very simple because it's all based on the actual retail cost of your drugs. Are you
Yep.
over or under $10,000? Right?
Yep. Yep.
That's
Do
kind
you
of how
do
I base
any
it.
do you do any insurance products, life insurance, anything like that?
Yeah, we do life, dental, 401k. We do group health insurance. We do have the gap policies. We are licensed and appointed with every major insurance carrier in the United States,
Okay.
and we're Medicare Advantage and Part D. I mean, some people can't afford to play the Medicare supplement game, the Plan G. Okay, some people have to go in their predisposition due to their income and their lifestyle. They need to go with a Medicare Advantage. We find the one that your doctor and your hospital takes.
Perfect.
Hmm. That's what we do.
Okay. Thanks for coming on.
Thank you.
I will send people your way when I get any questions because I do get questions sometimes
Yeah,
about
Medicare can be
insurance.
tough. It's a tough maze, but we really enjoy what we do.
Yep. Okay.
All right.
Thanks for
Thank
coming
you.
on.
All right.
All
Bye.
right. Bye.